we're going to get started with Winona Bynum talking today. The topic of today is of course food access, and right after Winona talks, we're going to have Alex Hill to also speak. So Winona, we're just going to have you to kind of introduce yourself, tell us what your positionality is, and get started with the program. Thank you so much, Winona.
Thank you, Dr. Daly. I'm Winona Bynum. I'm the Executive Director of the Detroit Food Policy Council. And I'm here to talk about a little bit about a project that we worked on with Wayne State, a collaborative project. Alex Hill has been so important in working on this with us from the very beginning. And he will also, he helps us gather data. So he'll be talking about that, the latest and greatest data in our metrics report. Next slide, please. While I am waiting for the slide to come up, I'll just talk a little bit about the Detroit Food Policy Council. First of all, I know for some in the audience, a food policy council may be a new, a kind of new or different concept, like what is it? So we are one of more than 300 food policy councils across the country. And food policy councils bring people together to talk about food system issues. So by training, I'm a registered dietitian. So often I would just talk to a lot of other nutrition professionals. However, a food policy council lets people talk across disciplines to talk about how the food systems should work. So people who are farming get to talk to people who are working in nutrition, who get to talk to people who are working in school food, and so on and so forth. And it's a nonpartisan type of activity. Next slide, please. So a little bit about the Detroit Food Policy Council specifically. So most food policy councils come out of government action or a health department. Ours in Detroit came out of community action. So like I said, we're one of more than 300 food policy councils operating across the country. We are networked with those food policy councils. We are also networked with the food policy councils across the state. They're about—
I see that written, but no one calls them yay.
There are people who do that.
20 to 25 food policy councils across the state. So activists and advocates came together in 2006, presented this food concept of a food policy council to our city council, the Detroit City Council. We found a champion and Reverend Dr. Joanne Watson on the city council at that time. And to make a long story short, our being was blessed by city council unanimously. And then we met for the first time in 2009. For the first 2 years, we were all volunteer. 2011, we got our first staff member, and we have been meeting continuously since 2009. Next slide, please. And so again, that's sectors and staff, and we get our work done through committees. And so under the Education and Engagement Committee, well, it's actually, this is an intersection between research and policy and education and engagement. So the first project I'll talk about is the grocery store project. And that has been a wonderful collaborative endeavor, with Wayne State being a partner and helping us convene the Grocery Store Coalition and do evaluation of the grocery stores. The research and policy, that metrics report that Alex will be talking about, that falls under that. Next slide, please. So a little bit about the Grocery Store Coalition. And that was really what I was asked to talk about, because this is a wonderful example of a partnership between Wayne State University and community organizations. So as you can see, the Detroit Grocery Coalition consists of many organizations, and not just organizations, everyday citizens who are interested in grocery store, what's going on in the grocery stores in the city. I want to say too, and step back and say, I am a proud Wayne State University alum.
You should need a blowjob for a long time.
Well,
So I'm a proud, and if everybody could mute if you're not talking, that would be great. I'm a proud Wayne State University alum. So I'm really excited that having a world-class research university right here in our city, that we're able to work together on projects and move the work of our community forward. So the Detroit Grocery Coalition, once again, is a collaborative. We've been meeting since 2012. It really started again out of grassroots, just a grassroots type of discussion. It was in a basement of a church, talking about the state of the grocery stores in our city. As most people, I'm sure, in this audience knows, most grocery stores in the city of Detroit are independently owned. One of the things that we really do at the Detroit Food Policy Council is we try to focus on asset-based thinking. So instead of thinking of that as a negative, we thought about how can we work with what we have, our independent grocery stores, how can we make sure that they serve Detroiters better? And Wayne State was really able to come in, do some evaluation for us. Alex, who you'll hear from later, he has been a part of this coalition and working to help us gather data. Dr. Dombrowski, now Dr. Alyssa Beavers, just working with us to help do evaluation to put what we already know. So if you live and work in Detroit and have gone to a grocery store, you probably know some of the issues, but you also may have wondered, like, how can we make this better? With the evaluation, they brought standardized ways of looking at our grocery stores and assessing what we may have experienced and putting it into words and helping us to put it into actionable steps. So we have done a couple of things. We have the Great Grocer Project. Next slide, please. The Great Grocer Project, and I know this is super tiny, but we will make these slides available. The Great Grocer Project, which focuses on a couple of things: community impact, the actual groceries that are available, and trying to get a roadmap where people can improve the grocery stores. Like I said, where we think about asset-based thinking, instead of looking at independently owned grocery stores as a negative, we looked at it as a positive. Because they're independently owned, we can approach an owner. I'm not going to get to talk to the owner or owners of Whole Foods or Kroger's. More than likely, they're not going to sit down and take time to talk with me about how to improve their stores. But when you have an independently owned grocer, they are more reachable. And so we put them in connection with community members. We work with community organizations based in those neighborhoods to bring neighbors together with the grocery store to talk about the things that they want to see, how they would like to improve. We also, through this project, I talked about evaluating stores. So we rate stores, but not with a view to knock them down, but with a view to show how they can improve. And we offer technical assistance to those grocery stores so that they can improve. And the grocery stores who are doing the best, we reward them with a banner. So if you see a Great Grocer banner in one of Detroit's grocery stores, you'll know that came from this project. We also are working with Healthy Corner Stores. And this is a project in connection again with Wayne State doing evaluation and with the state of Michigan, but showing how those partnerships are so very important and moving the work forward. It helped us get access to grant funds by having those partnerships, by being able to show that we had a strong evaluation component of the work that we were already doing. And it has just really been a very good example of how having Wayne State University and having big institutions in our community that are willing to work with grassroots on the ground organizations can just help us to move our work forward. with that, I'm going to turn it over to Alex, and he can talk a little bit about the latest food metrics, because we think that what is measured is what people look to, and it helps us to determine if we're moving the work forward or not. So Alex, I'll turn it over to you.
Great, thanks so much, Winona. And I think, you know, a big success story too from a lot of these initiatives is that we started collecting the data. And a big part of that, like Winona was talking about, the Food Policy Council pulls together folks from all different sectors in the food system. And so, you know, we in 2017 we noticed that the Food Policy Council hadn't really put together a report. We didn't have kind of those common metrics for all of these different sectors and organizations to look to. And so we started pulling the data together, but we did that by polling all of the members from all the different food system sectors to make sure that we were collecting the data points that most people wanted to look to or needed to look to for their programming or for their organizations. You can go to the next slide. And, you know, broadly, we were able to kind of get everyone on the same page with thinking about what is the food system, what are the different components. So looking at everything from food production and things like urban agriculture, all the way through the process of packaging and distribution, to then where people buy and eat food, to then the final stage, which would be food waste. Next slide. And so we had come up with these 12 food metrics that we update on a regular basis. You know, a lot of them are related to those major food sectors. I think the ones that we most often highlight is looking at grocery stores and how well they're either covering or serving the city. So you can see at the top here in purple, we've got 66 full line grocery stores in 2021. It's already, you know, close to the end of 2022, and we are back down to 64 full line grocery stores. When I started tracking grocery stores and surveying them in 2011, I had a list of 84 grocery stores. So in about a decade, we've lost about 20 full line grocers in the city. And those are, you know, the independent and community-based grocers. So even though we've gotten chain grocers to come back into the city, we're still seeing a lot of these really critical food access points disappear in communities. We do have, you know, farmers markets have continued, and actually during the pandemic, we added a few where we had none. So on the east side of Detroit, on East Warren Avenue, there's now a store. There's a farmers market in Jefferson Chalmers, and also a new one in the Palmer Park. You can see there are a few metrics here that are blank because they're really difficult to track. So that being food waste, we have some folks with Make Food Not Waste and the NRDC are working on tracking those numbers and figuring out a good methodology annually. The grocery retail revenue loss is a number that's really tough to get at unless you pay for a lot of data. But we'll find a researcher with a budget to help us that. Next slide. So since we started this in 2017, we've been able to set kind of, you know, this was our baseline and here's how things have changed. So we can see, you know, where things are improving or where they're not. So grocery stores being a big one that we've kind of seen this continual drop. A number of other metrics have also not continued in the direction that we'd want. The other one I'll call out is looking at food insecurity. So we use the United Way's ALICE threshold, and that's supposed to account for the you know, the fact that the federal poverty line hasn't been updated in decades, and so we see, you know, 69% of Detroit households fall under that ALICE threshold, which means they're a household that's asset limited, income constrained, but also employed. And those folks are most likely to experience food insecurity from month to month. Next slide. So for our 2020 report with the 2021 update, the NRDC and Make Food Not Waste, they were able to track down and create an estimate for food waste in the Detroit food system specifically. And so we broke that down by the different sectors that we're looking at. If you follow food waste in a food system, you won't be surprised that consumption is where the most food waste happens at the dinner table. But there is a few other areas in the food system that that area could be addressed. Next slide. This just gives it also a good snapshot of how things have changed, looking at just food retail in general. So full line grocery stores are the #1 location that Detroiters tell us they shop for food, followed by convenience stores and dollar stores. However, we've seen these grocery stores kind of disappear in neighborhoods. Convenience stores have also kind of shrunk their footprint, I guess. So places like CVS, Walgreens, Rite Aid, they've all kind of left a lot of neighborhoods in Detroit. And all of those locations, when they close, they quickly get turned around and kind of reskinned into a dollar store, whether that's Dollar General or Family Dollar. And for those who don't know, Family Dollar and Dollar Tree are the same company now. There was a massive merger. So we're only likely to see that continue to increase as we lose grocers. Next slide. And so here is just kind of a quick look visually at what was going on during the pandemic, which I'll note, that was a big focus of our report, but then that was also a really amazing, I think, implementation of our Detroit Grocery Coalition. It really kind of sprang to action during the pandemic when a lot of chain grocers really easily could get hand sanitizer and make signage and share masks, but independent grocers didn't have that same kind of support system built into it. And so we became that support system with the partnership of the Detroit Economic Growth Corporation and the City of Detroit's Office of Sustainability. And we were able to do that. We were able to get them hand sanitizer and safety signage and things for their employees to ensure that folks could still shop for groceries and do it safely. Next slide. This I think it's helpful to note, Detroit is known as an urban agriculture kind of international hub. But during the pandemic, a lot of the larger urban farms that were selling produce to restaurants downtown weren't able to do that anymore. And so they set up their own farm stands, which is those green dots. They popped up a table at the corner of where they were growing fruits and vegetables, and started just selling that produce in the neighborhood. And then we did see, this massive increase in food box distribution, whereas before that was really kind of a niche program that worked really well, and that really scaled up during the pandemic. Next slide. So my last slides are going to be, thinking again about food access, land access, and racial equity in our region. So, we can track, there are 32 Black farmers, and they make up just 13% of all farms and 7% of all farm acres. And by sales volume, those Black farmers in Wayne County are making less than $2,500 annually. So even though we have this really vibrant urban agriculture system in the city, in the county, that makes up a very small amount. And if we expand even to the region, looking at Oakland County and Macomb County and Monroe County, where the vast majority of produce is grown and brought to Eastern Market, the numbers aren't even trackable because there's so few Black farmers in those areas. Next slide. And so that's something to think about. This is my last slide. As we think about, what does Detroit's Black-owned food system look like? There is an effort now called the Black Farmer Land Fund. And so, we're able to see kind of the distribution there, working to help folks gain access to land. Most of these people right now are in the proposal phase. They're still waiting to get the land that they hope to so that they can grow produce in Detroit. There's a Detroit Black Restaurant Week to highlight Black-owned restaurants. And then there are no Black-owned grocery stores in the city of Detroit. The Detroit Food Commons is going to be, I think, probably the first one, which is a new food co-op launched by the Detroit Black Community Food Security Network. And then I'll also shout out Neighborhood Grocery on the city's east side. That'll be a kind of a smaller concept grocery store in the Jefferson-Chalmers area. Thanks.